Poverty, A Tale of Two Americas? A presentation by Carson, Canulette, and Ben Hess.
We may all hope to end poverty, but often we reach disagreements on the best approach to turn that hope into reality.
We first have to begin by asking the question, what is poverty? Specifically, how should we define poverty in the U.S. today? Should one's economic status be based on whether or not they have access to basic needs, such as food, clothing, shelter, and utilities? Should one's economic status be determined in reference to the rest of society? Or rather, should one's economic status be defined by their ability to take part in societal functions most considered parts of everyday life?
Upon defining poverty, the question still needs to be asked. How do we measure it? Many options have already been put forth, including the official poverty measure, OPM, a relatively absolute measurement in use by the federal government today, the supplemental poverty measure, SPM, a more holistic approach to setting thresholds that is more inclusive of individuals' actual financial circumstances, and a capabilities-based approach, a measure that considers one's abilities to self-actualize, and in doing so, escape the limitations brought on by financial burden.
We believe that poverty should be defined as significant material deprivation while also considering the social exclusion often brought about by income inadequacy.
The best measure of poverty has its foundations in a capabilities-based approach, implementing the supplemental poverty measure with additional considerations for the Human Development Index.
Now, getting back to poverty's definition. Some believe that those who have the financial means to acquire the basic necessities for life, often described as FCSU, food, clothing, shelter, and utilities, should not be considered impoverished. John Iceland, professor of sociology and demography at Penn State University, has written that the assumption underlying most absolute measures is that there is a measurable subsistence level of income or consumption below which people should be deemed economically disadvantaged or deprived. However, we believe that the dollar amounts derived from basic needs thresholds fails to capture the depth of poverty. Though it is relatively easy to quantify whether or not one has their basic needs met, the underlying question still remains. Does the fulfillment of basic needs allow for individuals to rise above the thresholds of impoverishment?
Others argue that poverty is best defined through a comparative approach to economic deprivation. Iceland expanded on some of the drawbacks of using relative measures when he stated, in particular, relative thresholds often decline in bad times as median incomes fall. To sum up his argument, as the median income falls, the thresholds decline. As thresholds decline, less and less people who previously received government assistance now qualify for those same benefits. This will in turn weaken the economy and incite a vicious cycle, bringing about an increase in the poverty rates over time. However, the benefits of the relative approach should not be ignored. It helps determine rises and falls in the standard of living and shows clear divisions between living situations across income levels. Additionally, there is another aspect to the relative approach that should not be ignored.
Social exclusion. To feel connected with your larger community, there are often some costs, both indirect and direct. For instance, one might be inclined to take a night off of work to attend a local block party. Someone might also decide to spend a few more dollars to get name brand products instead of the generic options of similar quality. Why, you might ask? In order to feel included with the larger context of society. However, those who are restricted by their financial means often cannot keep up with these substantial demands placed upon them. People want to walk out of their homes and feel dignified, and that doesn't always come through basic needs. That serves as a walking definition of poverty based on the social exclusion approach. It is undoubtedly difficult to concretely say when an individual is actually excluded based on financial resources alone, but due to the fact that this measure prioritizes one's humanity above all other factors, it should not be ignored.
Adam Smith, father of modern capitalism, articulated his perspective on social exclusion. To be poor is to lack what is needed to be a credible member of society. Smith sketches a powerful scene with this short quote, a scene in which a relatively impoverished individual is ostracized because of their economic status. We believe Smith's notion can help us better understand poverty, thus aiding in our endeavors to address impoverishment.
When trying to measure poverty, however, the government felt it was most effective to look at a family's income and compare it to a federal poverty line to determine their status as impoverished or not. This concept was actualized to be the official poverty measure, or the OPM, and is still in use today. Molly Orshansky of the Social Security Administration devised a plan to set this threshold in 1955 when she observed that families of 3 or more could be expected to spend about 1/3 of their post-tax income on food. With this idea in mind, she took those expenditures, adjusted them for family composition, and multiplied that figure by 3 to determine a theoretical poverty threshold. Although once considered very crude and only intended to be a temporary analytic, it is still the basis of today's standard measure. The OPM in general is praised for its easy calculation and black and white nature. Under it, you are either poor or not. However, there are many problems associated with it. It does not take into account where one lives. For instance, residents of Mississippi and New York have to abide by the same threshold, assuming they have the same family composition. Additionally, it does not take into account for what many would consider essential for maintaining a sufficient way of life: childcare, work-related transportation, medical out-of-pocket expenses, and other non-discretionary expenses. Taxes are also not included, and the units by which a family is measured is unclear. For instances, cohabitation of unmarried couples and foster children are often difficult to account for.
Robert Rector, a chief architect of the 96 federal welfare reform, has argued that being impoverished by OPM standards does not tell the whole story of poverty in the U.S. His data shows that although 30 million individuals fall below the poverty line, only a small percentage of that group is completely deprived of basic necessities. He has pointed out that most impoverished individuals aren't underweight by the time they become adults and live in a home with air conditioning, television, or other basic appliances. Rector implies that due to the presence of amenities in poor households, the measure of poverty needs to be redefined. However, we believe that defining poverty in terms of only FCSU, or presence of certain amenities, fails to capture the depth of poverty and answer the underlying question: is one able to rise up above poverty if they are only expected to live with the bare minimum?
There is another threshold-based approach to poverty measurement that is much more inclusive of a home's complete financial picture. The Supplemental Poverty Measure, or SPM, was formulated by the National Academy of Sciences in 1995. It contains several distinguishing factors from the OPM that many, including ourselves, believe make it the superior measure of poverty. Certain discretionary expenses, geographic location, and in-kind benefits such as Medicaid, SNAP, etc., are all accounted for as crucial components. The definition of the familial unit also underwent an overhaul. Cohabitation of non-married partners, relatives, and cared-for children under the same address now count as one entity. This accounts for the diversity in today's living situations, decreases the chance of unintentional bias in the final report, and helps prevent the monetary discrimination afflicting children and the elderly under the OPM. The formulation of the measurement is also much more long-term. A multi-year expenditure analysis of a 2-children, 2-parent household, and inflates much more appropriately with the rise in the costs and standards of living. Additionally, the cost of certain critical goods and services, such as MOOP, or medical out-of-pocket expenses, were accounted for through a multiplier attached to the threshold. This gives families a bit of wiggle room, as even the impoverished have to account for emergencies beyond their budget for FCSU. However, many do not believe this is an appropriate measure for poverty in the United States. There is no consideration of an individual's access to critical resources such as education, healthcare, childcare, etc., and it was never meant to be used in the context of legislation, rather an economic indicator.
The final approach is often regarded highly for its consideration of one's ability to improve their own situation. Although this measure is not independent from one's financial circumstances, it is a much more holistic approach to the measurement of poverty. The capabilities-based approach has its foundations in an individual's functionings, or the beings and doings of life. These could include one's education, access to adequate healthcare, living situation, and even religious affiliation. They define one's existence, and certain functionings have the tendency to limit an individual from actualizing another. This is the general idea of a capability, the combined set of functionings one could turn into reality. Whereas this seems to be the ideal approach as it focuses on one's ability or inability to rise above poverty, it is difficult to put into action. Many theorists recognize this, including Nussbaum, an American philosopher. However, this has not stopped her from developing the theory into a well-crafted set of ideals, including a list of 10 basic capabilities she believes are crucial for an individual to reach their full potential. Despite its abstract nature, it does not mean it's impossible to implement. However, the extremely individualized approach necessary to get the sufficient statistics is still hard to fathom as concrete policy.
Going off of that, we believe that there is already a well-established way to measure capabilities from a macro scale. The Human Development Index, instituted by the United Nations Development Program, or UNDP, in 1990, takes a look at the health, education, and standards of living across broad geographic areas. Many indices are calculated based on statistics of literacy, life expectancy, and are combined into one meaningful value, the HDI. It is important to remember that the OPM currently does not discriminate based on geographic location. This becomes problematic when you realize that Massachusetts has an HDI of 0.959, whereas Mississippi's is 0.866. The people of Mississippi are much less likely to have the capabilities to rise above poverty. So why are they held to the same threshold? We believe that this can be fixed with consideration of the HDI. If a multiplier can be feasibly calculated based on HDI disparities between states and applied to the SPM, each state can have their own poverty threshold. With the measure being based on federal statistics but adjusted for access to critical services, we believe that this is the best approach to the measurement of poverty.
Another representation of human needs is illustrated by Abraham Maslow, a renowned psychologist best known for creating his hierarchy of needs. In his 5-stage pyramid model, Maslow organizes needs by the order in which they must be fulfilled. We believe this organization of needs is correct and should be used as a reference when creating anti-poverty policy. However, we begin to disagree with Maslow when he asserts that deprivation is a viable motivator. While this may be true in some cases, it does not tell the full story of poverty. Frequently, people who lack basic needs are unable to self-motivate because of waning health. It's important to note that while Maslow's model cannot provide us with concrete measures, it can serve as a constant reminder that one's needs are not only FCSU.
Using the SPM in conjunction with the HDI, while providing additional consideration for one's capabilities, is the most holistic way in which to measure poverty. It expands upon the generally accepted definition of poverty and challenges us to consider what is needed to lead a meaningful life. If we hope to put an end to poverty in America, we must be intentional in our definition and measurement.
As a nation, we have become increasingly mindful of the crises associated with poverty, and although we have yet to determine a perfect measurement or definition, steps are being taken every day to better grasp the issue at hand. Thank you.